Hi, everyone, and welcome to episode 95 of the Pet Behaviour Chat. So, as promised at the end of last week's episode, we've got a slightly more clinical episode this week, and we're actually going to be talking about FIC in cats. Now, for those of you who aren't familiar with the term FIC, FIC stands for Feline Idiopathic Cystitis. So a disease that the reason that it's called idiopathic is because the pathophysiology, so how exactly the disease originates and what are all the risk factors sort of included and what is also the physiological development of the disease, some of those things are yet unclear. We have quite a lot of information about it, but I think there are still some points that we don't know exactly about. And I guess the important thing to note, so what do cats that suffer with FIC, what do they do? So the cystitis part of FIC, so the C in the terminology, the cystitis part, means that cats show episodes of straining to urinate, perhaps having blood in their urine. So a real sort of bladder inflammation episode. It's quite uncomfortable. They'll go to the litter box really frequently. They might strain to urinate. If they do urinate, they only urinate a few spots, and they might be in and out of the litter box quite a lot. Sometimes we also have stranguria, so this sort of really kind of those small elements of urine or small amounts of urine. So quite an uncomfortable disease for a cat to have. Now, there can be a number of different causes of cystitis. So cystitis can be caused both by FIC, so this kind of disease complex that we're going to talk about today. And in fact, it's the most common cause of cystitis in cats, with probably around 55 to 60% of cats that have cystitis suffer from FIC. But we also have other things such as stones, so bladder stones or crystals, for example. We can also get neoplasia of the bladder, and we can get bacterial infections of the bladder. Now, these things, especially the bacterial infections and the neoplasia, are much more common in older cats. So older cats with cystitis, so if we see a cat that's over 10 years of age, we're oftentimes more suspicious that there might be either perhaps a tumor in the bladder or the urinary tract, or maybe it's a bacterial cystitis. And that often is because the cat may be suffering from another systemic disease, let's say, for example, chronic kidney disease or diabetes, which is causing the urine to not concentrate as it should, and that leaves the bladder more open to bacterial infections. So bacterial infections and tumors definitely seen much more in older cats, typically cats over the age of 10. But then stones, whether they're uroliths, so bladder stones, or whether there may be stones that are in the urethra or the ureters, potentially even in the kidneys, that, as well as this FIC complex, are usually seen more in younger cats. And the typical age for FIC is somewhere between 2 and 7 years of age. Now, we just spoke about the fact that FIC is quite poorly understood. We don't know all of the risk factors. However, there has been some work done. So FIC is sometimes also termed as bladder migraine. It's this kind of inflammatory process in the bladder. There's probably some kind of dysregulation with some of the stress pathways. And kind of that terminology, bladder migraine, is probably quite apt. We likely also have a susceptibility. So we might have some individuals that are genetically more predisposed to getting FIC, maybe genetically or epigenetically. And then stress can play a big part as well. So oftentimes cats that are stressed, or as we'll see a second as we talk about a paper that I want to talk about, cats that are stressed or that are perhaps fearful in certain contexts might be more at risk for developing FIC. Now, one of the reasons that we are so concerned about understanding FIC better is because we often have recurrences. So a cat might have an episode of FIC, right? So might have a cystitis episode, and these can be self-limiting. So they may self-resolve after a few days, or they may require the intervention of a veterinarian to help reduce that inflammation, help the cat feel better, and give some kind of recommendations going forwards. But if we've had a single episode of FIC, it's very possible that we can get recurrences. So that sometime later, the cat has another episode of FIC. And we're somehow struggling to prevent these recurrences from happening. Now, the typical time frame is somewhere sort of around the 2-year mark. So a cat might have an episode of FIC, then not have any episodes, and then have an episode 2 years later. And that's kind of plus minus 12 months. So anywhere between sort of 1 to 3 years after an event, they might have another event. And we haven't been great yet at preventing these recurrences. And it's oftentimes when the cat has a recurrence that the owner may decide to euthanize. So we have a 20% mortality rate at the time of recurrence, which is oftentimes around sort of the 3-year after the first event mark. And that is obviously something that we want to try and avoid. So we want to try and reduce the recurrences, and we want to try and reduce this potential at euthanasia that might be associated with recurrences. And we want to better understand what is it that is perhaps increasing the risk of that individual to developing FIC. And some risk factors have already been identified. So there's been quite a lot of work that's been done on FIC. And even though there's been so much work, we still don't really know the whole picture yet. But some of the risk factors include obesity, so overweight cats, especially male obese cats, purebred cats, so some breeds seem to be overrepresented, for example, Persian cats, fearful behavior, and we'll dive into that a little bit more in a second, and also being an indoor cat. Now, there have been a few other studies that have got other risk factors in them. I think moving house is in one of the studies. And yeah, that kind of picture of a male indoor only purebred overweight cat, that seems to be sort of the classic picture that's often conjured up when we think about FIC. Now, one of the other big problems that FIC can cause is urethral obstruction. So we would call that a blocked cat. And that can sometimes come from maybe crystals, or we call it like sludge that can come from these inflammatory mediators as a result of inflammation in the bladder. And they can form these plugs, which can basically plug up the cat's urethra, and they're no longer able to urinate. And that obviously is a kind of a true emergency situation. So we often talk about blocked cat, that's kind of a classic veterinary emergency. We'll have a blocked cat coming in, and we know that that's something that we need to deal with immediately, because this cat may have not gone to the toilet for a number of days until perhaps it's been understood that they're not able to urinate. So that can be a real emergency situation. So again, another reason why we want to try and manage these FIC episodes better. So we've spoken about the mortality, and we've spoken about the fact that we don't really know exactly what causes it, but it's likely this kind of psychoneuroendocrine pathology. So it's something to do with stress, and then the neuroendocrine responses that are dysregulated. And then we've also got some abnormalities within the bladder. We've got these C fibers that seem to respond more, and we have this kind of inflammatory process. But one of the sort of major things that we often talk about are behavioral presentations, or a behavioral predisposition that might predispose a cat to either developing FIC. And FIC, by the way, is a diagnosis of exclusion. So we want to rule out everything else first and make sure we've got no stones, so no urolithiasis, no other systemic diseases, no bacterial infections, no neoplasia, all those things. So it's only when we've ruled everything else out that we can then safely say that, yes, this is FIC. But that kind of connection between FIC and stress and perhaps behavioral presentation. So that's something that we think a lot about. That's why we as veterinary behaviorists are often involved in these FIC cases, because as part of our plan to try and prevent these recurrences, we give lots and lots of environmental modification advice. And again, there's been quite a bit of research that's been done on what environmental or lifestyle modification should look like. And, there are lots of things from changing the diet, to a predominantly wet food diet so that we've got more fluid going into the cat, to making sure that they're drinking enough, to potentially offering an indoor-outdoor lifestyle, to reducing stresses, whether that's environmental stressors or social stresses in the home, as well as, providing amazing litter box setups and hygienes. We want to make sure they've got plenty of interest, interaction. There are whole lists of these environmental management pieces that we hope are going to prevent recurrences from occurring. But a recent study has just come out, and that's really what sort of prompted me to record this episode on this topic, is that just now in 2025, a paper has come out, a study has come out, which looks at the association between behavioral factors and the recurrence rate in these cats with FIC. And this is a study that's come out of Canada, a very good residency mate of mine, Isabelle Bazin, and Dr. Marion Desmarchelier, both of whom are now also diplomats of the American College of Veterinary Behaviourists, have been involved with this. And the first author is Marianne Caudron. So it's a study that came out of Canada. And basically what they did, it's a retrospective study. So they looked at a number of cats that were admitted to hospital for FIC between, I think it's February 2019 and March 2022. It's March 2019 to February 2022. So a 3-year period. They checked the hospital records of cats that had come in for FIC, where all other causes of cystitis were excluded. So they made sure that they looked for all the other things. Remember, we said FIC is a diagnosis of exclusion. And for these cats that really were truly FIC cats, they sent surveys to the owners to understand a little bit more about their sort of behavioral repertoire or parameters, their behavioral style, if you like, as well as what kind of environmental enrichment or environmental changes had been done. And they got results back from 33 cats. Now, that's not a huge number. It is quite a small study. Most behavioral studies have a small number. And 2/3 of those cats were male neutered, which is kind of typical. It's perhaps a little bit more common in male cats. And 1/3 of the cats were female. And so what they found was actually super interesting. So they looked at all of these cats, they looked at all of the parameters, they looked at all kinds of behavioral predispositions, whether there were aggressive behaviors present, whether the cat's urine marked, how was the owner compliance in implementing some of these environmental modifications, and how fearful or anxious were they in certain situations. And what they found was that there was a significant association, so a statistically significant association between recurrence of FIC within that kind of 20-month period, plus minus 12 months, so anywhere between, I guess, kind of a year to 3 years. So that there was a significant association between recurrence of FIV and fear towards unfamiliar people. So fear of strangers, perhaps fear of people coming into the home, and some of the sort of individual case reports actually mentioned that, there would be a recurrence perhaps after visitors had come, or maybe after visitors had stayed for a period of time in the home. That was oftentimes when these recurrences occurred. So statistically significant association between recurrence of FIC and fear of unfamiliar people. Then they looked at cats that were fearful to familiar people, so people living within the home, and there was not a statistical significance or a statistically significant association, but those cats were also overrepresented in the group that had recurrences versus the group that only had a single episode of FIV. So we can kind of deduce from that being fearful of people, especially unfamiliar people, potentially is a risk factor for the recurrence. So they looked at recurrences, not development, but recurrences of FIC. Where they found no differences, interestingly, was if the cats were aggressive towards people, there was no difference in the recurrence of FIC episodes. If they were the victim of aggression, perhaps in an intercat situation, Cats that urine marked didn't have recurrence of FIC more frequently, and also the owner compliance to implementing environmental modification pieces also didn't affect the recurrence rate of FIC. So really, really interesting. Now, it's always really important to make sure that we differentiate between statistical significance and clinical significance, or clinical outcomes or clinical implications for treatment, I guess. And what this doesn't mean is that we shouldn't be implementing environmental modification because it has no bearing on recurrence of FIC. That's not what it means. We absolutely still need to be doing all these things, and we need to be reducing stress in the home overall. So we also want to be managing social stress in between cats, so inter-cat aggression or inter-cat stress. And we also want to obviously reduce any situations where the cat might feel the need to become aggressive. So I think we always need to be really careful about that, right? We're not going to throw everything out the window just because this one study has shown us that it's fear towards unfamiliar people that has that statistical significance. But we do definitely want to perhaps pay a little bit more attention to how the cat feels when visitors come, or we might want to kind of modify that, or we might want to, maybe pop the cat into a different space so that they're not faced with the visitors, as long as they've got all their resources present, or whatever management strategies we decide to adopt. But I think having that kind of knowledge that a cat being fearful of strangers and maybe unfamiliar people coming into the home, potentially sparking a recurrence episode, I think that can be really useful information to us as vets and as veterinary behaviorists overall. So I just wanted to chat about this study because I always love kind of learning new things or new things that have been found. Of course, there are some limitations to the study, the sample size and so on and so forth, and the fact that, it's now 3 years since the end of their kind of sample collection timeline. So, they collected surveys from cats that came in between 2019 and 2022. So there might be some recall bias there, right? So the owners might not remember fully what happened in that time between 2019 and 2022, considering also that was COVID. So everybody's recollection of that time might be slightly skewed. So there are some limitations to the study, but I think, again, it can just give us some really nice insights. Plus, I think it really underlines the fact that behavioral factors, we absolutely have to look at them, and that, we always need to be giving some kind of behavioral advice when we have cats that we diagnose by exclusion with FIC, especially if they're this sort of very typical presentation of young cats, so somewhere in between 2 and 10 years of age, I'd say, younger cats, and they kind of fit that classic picture, our male, overweight, neutered, indoor only, perhaps purebred pedigree cats. Those are the ones that are going to be at risk, and those potentially are the ones that we're going to be really wanting to pay attention to their behavioral health. Although we want to be paying attention to behavioral health in all of our patients. So I think that's kind of everything I have for that. I just wanted to highlight this study because I think it's really great. And also just to remind people about the difference. So when we have a cat that presents with cystitis, so this is a training that I did in my clinic actually recently, when we have a cat that presents with cystitis, we have, a really sort of nice, I guess, algorithm or flow to look at in terms of, is this a cat that's an older cat, likely over 10 years of age, versus is this a younger cat? And that's going to really influence perhaps our initial workup or the direction that we're thinking of. So again, just as a reminder, older cats are usually bacterial cystitis, perhaps neoplasia, maybe urolithiasis, and younger cats perhaps would be more FIC, stress-related, behavior-related, more in need of lifestyle advice. And I think urolithiasis can probably be considered in all cases. I think it's important that we look for stones and crystals and, all those sorts of things, probably in every single cat. But yeah, I just wanted to give you that little update. I will, of course, be putting this paper in the show notes. And I also just wanted to mention to you that if you are a vet, or if you're a pet owner, but if you're a vet and you're looking for some amazing veterinary behavior handouts, so I mean, feline house soiling is such a big one, right? Cystitis is just one part of that. So if a cat has cystitis, they might urinate outside of the litter box, right? Because they have this kind of urge, these small amounts of urine. They might also associate pain with going in the litter box. So they might then choose to go somewhere else, which is not the litter box. So if we've got cats urinating outside the litter box, cystitis as a big complex is always something that we're wanting to be thinking about. And so if you are a vet that does see feline house soiling presentations quite commonly, I've got a fantastic handout within this ebook that I want to tell you about exactly about that. So I've created an ebook that contains 18 separate veterinary behavior handouts. We've got 10 canine ones, 5 feline ones, and then 3 kind of general information handouts. And they have been so popular. So the ebook has been so popular. You can get access to it immediately. You can either view the ebook or you can download it as a PDF and then print out individual handouts within that to perhaps keep in your consulting room. But yeah, so there's a great one on feline house soiling in there, which might be really helpful if you're seeing, these cases, and just to sort of try and remind you of what to think about, but also a handout to give to clients if they are if they come in and they tell you that their cat's urinating outside the litter box, and maybe it's right at the end of the consult, as it always is, that they drop in that piece of information, and you perhaps don't have time to go through that in great detail. You can give them a handout, you can send them away, and then they can come back to you, or you can bring them back for perhaps a more focused and detailed veterinary behavior consultation to kind of try and work up a little bit more into looking at why they might be urinating outside the litter box. So I'll drop the link to the ebook with the client handouts in the show notes as well. So you've got 2 things in the show notes: 1, the paper that I've just spoken about; 2, the link to the ebook, which I love and which has been so popular. So have a look at those if you're interested. And then the next 2 episodes are going to be a little bit about risk assessment and also the veterinary behavior first aid plan. So I hope you will join me for those. Thank you very much for listening today. I hope you've found this useful, and I look forward to seeing you next week. Bye for now.